I'm Dr. Bob Allman. I'm an assistant professor in the Department of Health and Physical Education. Well, exercise science, it is a science. It's rooted in human physiology and anatomy. Exercise science, but it's also an art. And I probably won't have time to talk about that now, but the exercise science program is rooted in physiology, and it's designed to use exercise either as a therapy or treatment for chronic disease or management of chronic disease. Exercise science is also used to increase performance in athletes or to make sure that athletes can perform at their peak level. It's using that science to improve people's lives, to manage disease or prevent disease, or to improve athletic endeavors. So it's all over the place, really. It's really a neat field as far as that goes. Well, actually, we have what I consider a state-of-the-art exercise physiology lab or exercise science lab. We have all the bells and whistles, which include, we have a brand new hydrostatic tank we just installed in July. We have a bot pod, which is state-of-the-art. It's used on things like The Biggest Loser. It's used on TV. It's used at the NFL combines. We have a variety of treadmills, new treadmills that are designed for testing scenarios. And you saw our big baby, our big treadmill that we can even test individuals with wheelchair, who are wheelchair bound, or bicycles, or whatever, on rollerblades. We have a treadmill that will allow us to do all that testing. We have complete VO2 max testing, which is a computer system that allows us to measure real fitness levels without estimating the actual measure. So I think one of the things that I'm proud of, and I think we're all proud of in our department, is that we do have a state-of-the-art lab. And when we recruit graduate assistants, for example, we have graduate assistants that come in and rarely have half of what we have. And I think the other thing is that I think is really good is that our students handle every piece of equipment in the lab. They actually use it at some point in their academic career. It's not for show. It's not for somebody to demonstrate. We actually want to. One of the things that we do with students here at IUP is we're trying to provide hands-on experience that is close to real-world experience. The problem we have is, I tell my students this all the time, testing a classmate is no fun because typically most of them are healthy. So we're trying to build in experiences in the lab so that they sort of get a sense of what it is to test a healthy individual. But we try to interject ideas about, well, if this was a cardiac patient, this is what would occur. If you were working with an athlete, this is what would occur. So we're trying to give them as much hands-on experience so that when they step into the internship experience, which they have to before they graduate, that they have a sense of what's going to happen in that real-world environment. So we need to have them ready for that, for one. The other thing that we talk to them about often is professionalism, how to deal with clients, how to interact with clients, developing rapport. So all of those things are actually built into all of our classes. They don't hear this message once, they typically hear it in a bunch of classes. So we're trying to get them ready for the real world. We're trying to get them to understand that all learning doesn't occur in the book. It's not in the classroom. We have to give them that real world experience so that they understand that sometimes textbooks tell us something, but that's not what happens in the